Wow. Hello there, how are you today?
I'm fine, I'm fine.
Well, tell us about yourself.
Well, I was a runner for about 40 years and the pounding got to me and I couldn't run anymore, but I still needed the exercise. So I found this GlideCycle, and for the past year I've been running on the GlideCycle. I used to run 3.5 miles, my normal jog, and now I'm running 8 to 10 miles for my exercise. It really gives me good exercise, stretches out the muscles and the joints. Unfortunately, when I was on my bike 2.5 weeks ago, I was in a bike accident and knocked off my bike, and I broke my hip and my right shoulder. And I had surgery, and about 5 days later I felt pretty good. I thought I'd get on the GlideCycle and see what could happen. I was able to take a few steps on the GlideCycle, and I knew that I wasn't on a flat area. And the following week, by the end of the week, 1 week after surgery, I was on my GlideCycle for a half hour running on the level ground. No pain in the hip, takes the pressure off my hip. I have full extension and flexion of the hip and not putting any stress on the bone itself. It's wonderful for rehabilitation. Now I get my exercise, I'm rehabilitating my hip as I go, no problems, and I think this is a wonderful progressing after hip surgery, and knee surgery would do the same thing.
Well, this is from personal experience. Now, what is it about this that makes it special for post-surgery rehabilitation?
Well, if you can see, I'm sitting on a seat. It's a padded seat, but it gives me great motion of my leg. Actually, this is my fractured leg. I can bring it up and down, and full motion of my knee as well. But it takes the weight off. I'm suspended on some straps here, and also the pounding is taken off by the frame here. So I don't have to put any weight at all on my leg, but I still get the exercises like running on the moon or running in water, but it's better exercise.
Well, that's fantastic. And you're 69 years old right now?
I'm 69, and actually I'm the one that does I didn't do my own hip surgery, but I do hip surgery on a lot of other people, and knee surgeries for fractures and total joints, and I think this is a wonderful rehabilitation gadget. We also have it on a treadmill, so that people who don't have the balance can get on a treadmill and slowly start and progress in their rehabilitation.
Wow, that's fantastic. Dr. Levin, that's a real personal experience that we don't want you to repeat, but it's given you an opportunity to get a first-hand view of what it's like to rehab. Now, what other equipment could people use to do the same thing? Or does this excel, in your opinion? Or?
Well, there are other unweighted equipment around. One's called the Alter G. It's very good in what it does, but it doesn't get you outdoors, and it's extremely expensive. And the way it's set up, you can't get to people's legs as easily, and getting into it isn't as easy as getting into this. So people with fractured hips or total hips and knees would have a little more problem with the Alter G. Actually, the Alter G is used for the ultra sports for rehabilitation, but this is the same technique, but a lot less expensive, and actually in a lot of ways much better.
Now, what were the traditional techniques used for rehabilitating those kinds of injuries before body unweighted technologies such as the GlideCycle, GlideTrak, and Alter G came out?
Well, the standard physical therapist has parallel bars and a walker, but people who don't have good upper body strength have a lot of trouble on the walker and have a lot of trouble on the parallel bars. So they're sort of very limited on getting up and walking because they can't put full weight on their legs, but they don't have their own upper body strength to keep the weight off. This, you don't need any upper body strength at all, and especially on the GlideTrak, the one for the treadmill, you don't need any at all. And there's a development of a four-wheeled GlideCycle. It's called the GlideCycle four-wheeled, and that would be excellent for people who have trouble getting around on a walker.
Well, I want to ask a pointed question here. You know, you broke your hip. It's pinned together. It's a serious fracture. If you went to a normal therapy department, you'd be on a walker and on parallel bars. Well, tell me what you've done in the last 2 weeks on this GlideCycle.
Well, I've been running up to an hour at a time to get my exercise. That was 1 week, actually 8 days after I had the surgery. I did an hour. The day before, I only did a half hour. I was trying out what I could do and what I couldn't do.
And at what speed?
I wouldn't be anywhere near that if I didn't have a GlideCycle.
And at what speed?
Well, actually, I was doing between 8 and 10 miles an hour on this.
With and we're talking like 8 to 10 days after your surgery.
Right.
That's stellar. You're not going to do that on a parallel bar.
Not at all.
Now, I have a question to ask you. On the parallel bars, your recovery would be limited to a couple of hours of therapy a week, and your range of motion, etc., would be, developing at that rate. Has your range of motion and your level of pain, and essentially your recovery, been accelerated by this body unweighted experience of, geez, through the last 3 days, you ran an hour each day?
Right. All the doctors who know me and the therapists who know me are just amazed at my progression and my recovery. And they're going to start using this technique a lot more on their patients.
Dr. Levin, what would you say the world should know about the GlideCycle experience and body unweighted training?
Well, body unweighted training, it gives the lower extremities the ability to get full range of motion and strengthen the muscles in their full range that they're allowed to go, and it helps strengthen and progress much faster than any other technique that we have, without putting any damage or injury with the weight bearing itself.
That is fantastic. So you'll be continuing your recovery, and I'm sure we'll have another update here.
Well, I'll probably be running without anything pretty soon. I still use crutches just for long walks when I get from here to there, but I can use the GlideCycle a lot farther and a lot faster.
I'm sorry, you said you were using crutches when you're not on the GlideCycle?
When I'm not on the GlideCycle, I still have to use crutches. I don't have the full capability yet of full weight bearing. But that's what this gives me. I can get going places and exercise partial weight bearing, and that's the name of the game.
Dr. Levin, how many years have you been in practice?
Over 33 years.
33 years of practicing as an orthopedic surgeon. Is this revolutionary or what?
I think this is. I think this is going to change rehabilitation as we know it.
You've worked with Dr. Nancy Bill from the University of California Medical School.
Yes, I know Nancy Bill. She's a PhD in physical therapy. She's doing wonderful experiments with body unweighting training, and she is amazed on her results. And the GlideTrak and the GlideCycle are integral parts, as I understand, of her program.
Well, that's fantastic. Well, we're trying to do what we can to get the word out and let people know that there is this equipment out there, and your experience firsthand is not something we wish on anybody, but it is giving you an unusual perspective.
It gives me an unusual perspective as a physician, and we hate to be patients, but sometimes it really gives us insight.
Excellent. Thank you so much for chatting with me, and if you don't mind, I'd like to see you run away.
Okay.
You have to back up here a little bit, and off he goes.
Okay, my fracture is still healing. You can see the bruise that I have, so and the scars are doing great, and this is new modern medicine.
Love it.